What if your muscles were slowly suffocating? Not from lack of oxygen, but from the buildup of something as ordinary as sugar. That's the reality of Pompe disease, a rare but serious genetic disorder caused by the body's inability to break down glycogen, a storage form of glucose. Pompe disease results from mutations in the GAA gene, which encodes the enzyme acid alpha-glucosidase. This enzyme is responsible for degrading glycogen in lysosomes. When it's deficient or absent, glycogen accumulates within cells, particularly in cardiac, skeletal, and respiratory muscles, leading to progressive weakness and organ dysfunction. The disease presents on a spectrum. Infantile-onset Pompe disease appears within the first months of life and is marked by severe muscle hypotonia, feeding difficulties, respiratory distress, and hypertrophic cardiomyopathy. Without treatment, it is typically fatal within the first year. Late-onset Pompe disease can emerge in childhood or adulthood, often sparing the heart but causing slow, debilitating muscle weakness and respiratory issues. Currently, the primary treatment is enzyme replacement therapy, ERT, using recombinant human GAA, which can improve cardiac function and extend survival, especially when started early. Supportive care includes physical therapy, respiratory support, and sometimes ventilatory assistance. This content is for educational purposes only. Subscribe and follow for more science-backed learning.